If you've tried 2 or 3 antidepressants and none of them worked, it might not be you. It might be one gene. Roughly 30% of people metabolize SSRIs differently because of a gene called CYP2C19, and most doctors never test for it. Here's the reality for millions of people. You go to your doctor because you're struggling with depression or anxiety. They prescribe an SSRI, maybe escitalopram, maybe sertraline. You wait 6 weeks, nothing. So they try another one, then another. This cycle has a name in psychiatry: medication roulette. The average person with depression tries 2 to 3 medications before finding one that works. Some people try 5 or more, and every failed trial means weeks or months of unnecessary suffering. To understand why this happens, you need to know what SSRIs actually do. SSRI stands for Selective Serotonin Reuptake Inhibitor. The drug enters your bloodstream, reaches your brain, and blocks the reabsorption of serotonin, keeping more of it available. But here's the part most people don't realize. Before the drug can do any of this, your liver has to process it. And the enzyme that processes most SSRIs is called CYP2C19. Here's what's actually happening at the molecular level. When you take escitalopram, the most commonly prescribed SSRI, it travels to your liver. There, the CYP2C19 enzyme breaks it down into a metabolite called S-desmethylcitalopram. In a normal metabolizer, this happens at a predictable rate. The drug reaches therapeutic levels in your blood, does its job in the brain, and gets cleared at a steady pace. But if you're a poor metabolizer, this enzyme is underactive. The drug accumulates. Blood levels spike higher than intended. That means more side effects: nausea, insomnia, agitation, at the same dose that works perfectly fine for someone else. Now, CYP2C19 isn't binary. It exists on a spectrum. About 2% of people of European ancestry are poor metabolizers. Their enzyme barely works. Around 18% are intermediate metabolizers, somewhat reduced activity. Most people, about 60%, are normal metabolizers. And roughly 5% are ultra-rapid metabolizers. They clear the drug so fast it never reaches therapeutic levels. That's the other side of the problem. For ultra-rapid metabolizers, SSRIs may simply not work, no matter how long you wait. And this doesn't just affect one drug. CYP2C19 is involved in the metabolism of at least 7 commonly prescribed psychiatric medications: escitalopram, citalopram, and sertraline. 3 of the top 5 most prescribed antidepressants are all CYP2C19 substrates. The Clinical Pharmacogenomics Guidelines, called CPIC, have Level A evidence for dosing adjustments based on CYP2C19 status for these medications. So what can you actually do with this information? First, pharmacogenomic testing exists. Services like GeneSight offer clinical-grade panels, but they typically cost $300 to $2,000 and may not be covered by insurance. Second, if you've already done consumer DNA testing through 23andMe or Ancestry DNA, your CYP2C19 status is almost certainly already in your raw data file. You just need a way to extract and interpret it. Third, and most important, whatever you learn, bring it to your prescriber. A pharmacogenomic result doesn't replace clinical judgment. It informs it. The goal is to have a more productive conversation with your doctor, not to self-prescribe. If you already have 23andMe or Ancestry DNA data, the link in the description lets you check your CYP2C19 metabolizer status and see how your genetics affect over 100 medications. The upload is free. You get 9 trait insights immediately.